Hello, everyone. Thank you for joining us today for this wonderful webinar session on the role of respiratory therapists in managing pulmonary fibrosis by Jenna Jangalee and Tina Xu. Jenna is a registered therapist with 15 years of experience in the field. She's a certified respiratory and tobacco educator and a co-founder of Poplar Pulmonary Wellness. Jenna finds joy in helping people breathe easier. Having had asthma herself since childhood, she knows the importance of helping people understand their lungs and helping them to gain access to the tools they need to get back to the life they want to live. Little did she know that her personal journey with asthma would profoundly shape her professional career, but she's happy it did. Jenna has worked different roles as a respiratory therapist, including work with patients admitted to hospitals to support their airway and breathing, to spending time one-on-one with clients and their families to develop respiratory care plans as an asthma COPD educator and performing breathing tests in clinics in a community. She's enjoying getting to know her patients and being part of the care team. As Jenna's career has developed, she has met a wide variety of patients and has given her the breadth of experience to know that each person has a different set of needs and goals. Her work at Poplar Pulmonary Wellness is her next step in providing people with personalized and individual care that gets them living their best lung life. When not working, Jenna enjoys being a mom, watching movies, and figure skating. Tina Xu is a passionate respiratory therapist and a certified respiratory educator with a wide breadth of experience. Her career has included working in emergency and intensive care units at Vancouver General Hospital, as well as long-term and community care centers. Tina has worked with patients in acute distress and those looking to better manage their chronic conditions. Currently, Tina is a clinical site coordinator at Thompson Rivers University Respiratory Therapy Program, where she guides students through their clinical years. Tina was also elected by her peers to be the Director of Education for the BC Society of Respiratory Therapists, where she helped enrich the practice of her colleagues across British Columbia. In co-founding Poplar Pulmonary Wellness, Tina is looking to bring her hands-on experience, her academic insights to significantly improve the lives of her patients. Tina believes that delivering quality patient care is her first priority and the greatest source of joy in her practice. Tina is a fitness enthusiast. She enjoys the relaxation of her daily yoga practice and going outside regularly for energizing run or bike ride. Tina has also done triathlons, and her biggest success was completing the Ironman Canada in 2010. Thank you, ladies.
Thanks for having us, Sharon.
Thank you, Sharon. So hi, everyone. We're here today to talk to you about the role of respiratory therapists in managing pulmonary fibrosis. There has been some amazing talks through the Hope Breathes Here campaign, and we hope to actually tie in a lot of what you've perhaps learned already into managing pulmonary fibrosis, and in particular with the lens of a respiratory therapist. So the Canadian Pulmonary Fibrosis Foundation reminds us that breathing should never be hard work. And as respiratory therapists, we can help you to support your own breath at every step of your journey.
So Jenna and myself are two of the many RTs across Canada. We're both respiratory therapists with about 15 years experience each. And we're also certified respiratory educators. And we've come together to found an independent business called Poplar Pulmonary Wellness. Poplar Pulmonary Wellness is a budding respiratory therapy company. We're providing online exercise and education courses for people who live with chronic lung conditions. We help people to live their best lung life. And you can find us at poplarpulmonary.com.
So our objectives for this talk today is just to highlight the role of a respiratory therapist in Canada. As Tina had mentioned, there are hundreds of us across Canada. We hope that you learn how a respiratory therapist can be integrated into pulmonary fibrosis management and care. And we hope that we can provide you the tools to build confidence in accessing respiratory therapists in the community where you live.
So what's a respiratory therapist? We like to say that we're a bit of a hidden profession because people who have not needed a respiratory therapist have often not heard of one. The COVID outbreak has helped us a little bit get word out there that we're there, but it's still a little bit difficult to explain to people what we do. So we are healthcare professionals who diagnose, treat, and care for people who have trouble breathing. So as you can imagine, that would be anybody from newborn babies right through end of life care. And a lot of diseases or conditions or traumas can cause respiratory difficulty. So we do see a wide variety of people on a regular basis. Where would you find an RT? Most RTs work in acute care in hospitals. So that's where a large number of us are found. Mostly in larger cities with specializations, but any hospital will have an RT. We work all over the hospital, not just in one area. So a lot of us will be in emergency or intensive care units. We work in operating rooms and also on every floor. And we mostly carry pagers. And so if somebody is having respiratory distress, we'll get a call and we'll magically appear. We work in diagnostics. So pulmonary function testing, doing breathing tests, polysomnography, which is a specialized area we can get into, which is sleep tests. So that's usually people who need CPAP machines if they have trouble or stop breathing at night. And we also help with testing to decide if people need supplemental oxygen. So that would be oxygen at home. You can find us in the community, and this is a growing area in multiple professions, but respiratory therapy as well. Doing prevention, education, especially with tobacco cessation, doing pulmonary rehab, which is exercise, oxygen delivery. We can help provide airways and ventilation for people living with conditions at home. So those are BiPAP and CPAP machines. And so we're going to take you through Jim's journey. So Jim is a fictitious patient. If he sounds familiar, it's not. We made him up. I chose the name Jim because of my stepdad. He passed away from lymphoma, not pulmonary fibrosis, but sort of a tribute to him. And so we're going to follow Jim through his journey through the lens of a respiratory therapist, and we'll see all the different care points where Jim may run into an RT.
So Jim's journey begins. Jim is a 56-year-old male, previously healthy and fit. He starts to notice some shortness of breath and a dry hacking cough that just won't go away. So he decides to see his family doctor for assessment. And as part of his workup, he goes in for some breathing tests.
So this could be in a pulmonary function lab. This might be one of the first places that Jim meets a respiratory therapist. And it's generally going to be a respiratory therapist who will walk Jim through all of these breathing tests, and we call them spirometry. And so Jim will have to do a whole bunch of breathing maneuvers, inhaling and exhaling quickly, slowly, panting. He may get breathing into different devices. And through this, we're measuring things like volumes, we're measuring the elasticity of the lung, the recoil, and the airflow, which can indicate things like inflammation or restriction. We can take Jim on a short 6-minute walk test, and that helps us see if his breathing is limiting his ability. We'll check his oxygen levels. We may also check his oxygen levels with a little clip on his finger, but also by taking a blood sample from his wrist, which is blood that comes straight from your lungs. And so it tells us how the lungs are working. And we can also do bronchoscopy, which is putting a camera down into the lungs, where they can look at the lungs and even take some samples. All of this information is then given to a respirologist for interpretation. So pulmonary fibrosis is what we call a restrictive lung disease. And so basically the characteristics is it's like having a whole bunch of elastic bands tied around your chest, or like if somebody's holding you in a tight bear hug. And so it's difficult to take a breath in. And now there's not actually things on the outside of your lungs pushing, it's actually the lung tissue itself that gets inflamed and eventually gets scarring and fibrosis. So the lung itself is very, very stiff, and it's difficult to take a breath in, as opposed to other conditions that are difficult to exhale. So pulmonary fibrosis, it's usually taking a breath in that the patient experiences the problem. So key message for diagnostics respiratory therapists is they're a good resource to help you understand your diagnosis. We aren't the ones who actually give you the diagnosis, but we can help you understand it and explain how that relates to the symptoms that you're experiencing with your specific type of pulmonary fibrosis.
So Jim's journey continues with early intervention and chronic disease management. So after having his tests done, Jim sees his doctor for diagnosis and ongoing care and management of his pulmonary fibrosis. Some family doctors may choose to refer their patients on to specialized lung doctors called respirologists. And then some of those respirologists will further specialize in the care of those living with pulmonary fibrosis. So there may be multiple physicians involved in your care and management. Some respiratory therapists attend extra schooling and become certified as respiratory educators, such as Tina and myself. And we can be found in doctors' offices, family health teams, and respirology clinics. Ask to meet with one. So wherever you're interacting or continuing on with your care management, ask if there's a respiratory therapist you can talk to. Often respiratory therapists have the training to provide personalized care plans. So even within the realm of pulmonary fibrosis, everyone is not the same. You might have a different type of pulmonary fibrosis and therefore a different care plan. So respiratory therapists can provide education on pulmonary fibrosis so you understand which type you have and have an idea of what's happening in your lungs. They can teach you breathing techniques. So how to breathe easier. This can involve how to breathe easier with exercise, how to breathe easier with different triggers. And they can also teach you along the lines of triggers, how to avoid them so that you can slow down the progression of your pulmonary fibrosis, which is one of the key things to think about, and what your healthcare team will be talking to you about are ways to slow down the progression of fibrosis. Respiratory therapists can help you to create a plan of action in case your breathing worsens. So depending on the type of pulmonary fibrosis you have, you may stay stable for a long period of time. You may have the type that progresses really rapidly, or you may have the type that is prone to periods of worsening and then periods of stability. And so it can ease a lot of anxiety within yourself, sort of knowing that you have a plan and you know what to do should your breathing worsen. And respiratory therapists can help you develop those plans and much, much more. So respiratory therapists, as part of your management plan, you may be referred on to pulmonary rehab, or you may seek out pulmonary rehab yourself. And respiratory therapists work in these urban and rural pulmonary rehab programs in Canada. There are a lot of different healthcare professionals that work in pulmonary rehab programs. So with respiratory therapists, you might also be working with a physio or a chronic disease nurse. And some pulmonary rehab programs will be out in the community. So for example, in community centers, or you might attend one that's attached to a hospital setting. So what is pulmonary rehab? It's an exercise, education, and self-management program geared to those living with chronic lung conditions like pulmonary fibrosis. We would really recommend these programs to everyone living with chronic lung conditions. And ideally, hopefully you'll have access to one really early on after your diagnosis. Pulmonary rehab is a tool that pulmonary fibrosis clients can use to learn how to slow down the progression of disease, but most importantly, to improve your quality of life. So those things that you love to do, we want you to keep being able to do them. Even if it's just simple activities of daily living, getting dressed, cooking food, hanging out with your friends and your loved ones. Pulmonary rehab can really help you achieve your goals. Pulmonary rehab also teaches you how to manage your symptoms of cough and shortness of breath. And it also provides a bit of a natural support group. So many pulmonary rehab programs are in group settings. And with the COVID-19 pandemic, many have transitioned to virtual. So meeting online over the computer, via Zoom, for example. And so you get to meet other people living with chronic lung conditions, including other PF patients. And so there's a natural support group that gets formed, and you can continue to support each other and connect with each other. And it's really lovely when the groups get together in pulmonary rehab. So the other thing to kind of think about in terms of managing pulmonary fibrosis is this idea of support groups, because other than just being there for each other and educating each other and sharing shared experiences, we do know that anxiety and depression can also be common in those living with chronic lung conditions like PF. And this anxiety and depression can occur in caregivers as well. So we really encourage everyone to seek help and support, whether that is through a pulmonary rehab program that you're attending, whether it's through your local Canadian Pulmonary Fibrosis Foundation chapter. The Lung Association also has support groups in Canada, often known as Better Breather groups. So if you go to the Lung Association website, you can look up your local Better Breather group to find connection. We provide support through Poplar Pulmonary Wellness and through your healthcare professionals. So please ask and seek help if you need it. So the key message here is that you can seek access to a respiratory therapist or certified respiratory educator as part of a pulmonary rehab program, and we encourage you to seek those out as early as possible. Your quality of life is really important, so learn the skills that you need to keep doing what you love.
All right, so we'll continue on with Jim's journey. So Jim has been diagnosed with pulmonary fibrosis, and unfortunately the scarring that happens inside the lungs can't be reversed, but there is research ongoing. And so depending on what type of pulmonary fibrosis Jim has, he may, and what point he's diagnosed in his disease process, there might be a few different options that are available to him. And so he should really be talking about this with his healthcare providers. So the treatment's goals are to reduce symptoms, increase the quality of life, and slow down the disease progression. So as Jenna said, to keep on doing the things you love to do for as long as you can do them.
So in terms of pulmonary fibrosis treatment, again, it sort of comes down to the type of pulmonary fibrosis that you have. And a lot of this will be shared decision-making with yourself and your doctors and other healthcare professionals involved in your care. Some of the hallmarks of treatment, however, again, depending on the type of pulmonary fibrosis you have, might be anti-inflammatory medication, it might be anti-fibrotic medication, or it might be medication to suppress your immune system a little bit. So a respiratory therapist can definitely connect with you to help you understand what treatment path you're on, and perhaps a little more education as to what some of these medications might do. And together with your healthcare team and your physicians, you'll assess what's working and what's not working. Another hallmark of treatment is supplemental oxygen. And like we mentioned earlier, you might have tests done to determine whether that's needed or not. And we're going to talk more in depth about oxygen in a couple slides. But a respiratory therapist is very involved with oxygen treatment, whether it's the diagnosis, whether it is accessing it in your community, or whether it's dealing with the equipment involved with wearing oxygen. Another thing to kind of think about that might be part of the treatment plan might be controlling cough. Perhaps that's with medication like cough suppressants. Again, that is shared decision between you and your physician and healthcare team. We can definitely go through techniques in terms of controlling cough, and that can be learned in pulmonary rehab or just speaking with a respiratory therapist. The other kind of things to think about that are might be a more non-pharmacological approach is trigger avoidance, which can be really important to both highlight what triggers you, what triggers that change or that worsening with your symptoms with your PF. And one of the big ones is acid reflux. So you might be on treatment, medication to control acid reflux, but part of it is lifestyle. So part of it is learning, you know, what foods am I eating that might be contributing to acid reflux? How can I avoid those? Or what are some other techniques I can use, like sleeping with my head of the bed raised, or trying to avoid bending or putting pressure on my abdomen. So a respiratory therapist can definitely connect with you to talk about triggers like acid reflux and develop a personalized plan. And the same thing goes for tobacco use and quitting smoking. So we know that inhaled tobacco can be a trigger. And so really working with the respiratory therapist or your other healthcare professionals on developing a quit plan might be part of your personalized plan. The other thing, perhaps, as pulmonary fibrosis progresses, and we're going to again touch on this in a little bit, is maybe lung transplantation is an option for you in terms of a type of treatment. So we'll go into that in a little bit. And lastly, as a part of a treatment plan, depending on where you are in your trajectory with pulmonary fibrosis, or on what your goals and beliefs and values are, perhaps a palliative care approach and using medications to really support you and keep you comfortable, especially with shortness of breath, might be part of your treatment plan. And respiratory therapists more and more are getting educated on palliative care approaches and can definitely be part of your multidisciplinary team in terms of palliative care. So the key message for pulmonary fibrosis treatment, so respiratory therapists can help you navigate your treatment plans, including access to medications such as the antifibrotics like pirfenidone and nintedanib. These medications are very expensive. They may not always be accessible, but a respiratory therapist can work together with your physicians and other members of your healthcare team to try and work to get you access or sustain access, or just make it an affordable option for you. Respiratory therapists can help you avoid respiratory triggers, whether it's by helping to develop a quit plan or connecting you to resources where you live, or they can provide one-on-one support for smoking cessation. They can counsel you on how to prevent triggers like acid reflux and teach you controlled cough techniques.
All right. So in our little story here, Jim ends up getting tested for home oxygen. So part of the pulmonary fibrosis progression can lead to shortness of breath due to low oxygen levels in the blood. And so pulmonary fibrosis, you get this scarring and thickening of the lung tissue. And so it's more difficult and slower for oxygen to go from inside your lungs into your blood. And so people with pulmonary fibrosis can have low blood oxygen levels, and they get short of breath because of that. So with home oxygen, so getting oxygen at home, it's quite the setup. There's specific equipment required, and there's funding paperwork and qualifications that need to be sorted out. So speak with your respiratory therapist on how to do that, and they can help fill all of this out, let you know if you qualify. We do the testing and the paperwork, and we'll come and see you in your home. So one of the first steps is the physical requirements. And so home oxygen is managed by each province. They might all have slightly different criteria, but they're very, very similar. So chances are, if you're in one province and moving to another province, you would still qualify if you already qualified in your home province. And so there's a respiratory therapist that would work for the provincial home oxygen therapy program, as well as an RT that would work for the independent oxygen provider company. So some of the provider companies are listed here. This is by any means not an inclusive list. These are some of the bigger companies: Medagas, Vital Air, ProResp, and InspiAir. And so the respiratory therapist would help fill out the paperwork, and you would go home, and then a respiratory therapist would come to your home. They would conduct some more testing there, usually with just a little clip on your finger to check your oxygen levels. And then they would pick the equipment for your needs. So there's a variety of ways you can have oxygen. There's concentrators, and there's tanks, gas tanks, as well as liquid tanks. There's even cylinders that you can fill up at home with a bigger concentrator, and they even do make portable concentrators for walking around, depending on the level of oxygen that you need. So just be aware that there are the 2 respiratory therapists that you might see coming to your home, and they're a terrific resource if you have any questions or needs with the equipment.
Excuse me, I just want to for a
yeah.
second, Tina. Someone in the question box had wanted to say, can you elaborate more on the types of PF? Because most physicians and insurance mention only IPF and associated medication. And I've replied in the box to say that that's because it's the most research study that we have, about pulmonary fibrosis, but there are other types because there are 200 types of ILD diseases. So I don't know if you and Jenna are able to explain a little bit more on that.
Like go through them, or
just to say that.
Yeah.
What types do you?
Sure. So like Sharon alluded to, it's a complicated answer, because it's, if you want to think about it as an umbrella. So interstitial lung disease, this inflammation we've been talking about that can sometimes lead to fibrosis and scarring. There are many things that can cause that. And so that's why often if they're thinking about that diagnosis from some testing you're doing, you often will get referred on to a specialized respirologist to kind of help them tease out your specific ILD or your specific diagnosis. So under that umbrella of ILD, like Sharon said, idiopathic pulmonary fibrosis is one type. And so what they're looking at is when you break apart what is happening in the tissue between air sacs in your lungs and the blood vessels, there are lots of different cells that are involved that might be contributing to that scarring. And so what are the cells? What caused it? So did you have an exposure that sort of precipitated that cause? So was it work related, like asbestos or silicosis and things like that? Or was it something that we call an antigen? So something you breathed in, a common one is sort of exposure to avian type things like birds. So was there something you breathed in that caused an inflammatory response in that area of the lungs? Do you have something more systemic? So when we say systemic, we mean within the body, where you have something going on the body, but as a result of that, fibrosis is showing up in the lungs. So do you have rheumatoid arthritis? Have you been diagnosed with scleroderma? All of these fall under this big umbrella of interstitial lung disease. And I think that's why we bypass it so quickly, because there's no way we could sort of stay here and go through the 200 to 300 different reasons you have fibrosis. But it does kind of highlight, yes, understand what type of fibrosis you have, ask questions, really ask to be referred to those professionals who can either tease out specifically what kind of fibrosis you have, and then go on to further understand it yourself. Yeah.
Thank you. The other question in their Q&A was that someone wanted to know that there's only been only the antifibrotic drugs have only been approved for IPF in BC. I just wanted to add that actually nintedanib, or better known as OFEV, is actually now approved for people with other fibrotic ILDs. The only thing that has not been approved is the ratepayers for reimbursement. So you can access that drug if your respiratory doctor prescribes it, and if you have a private plan or if you're able to cover it, but you can access it, but it's not covered by the healthcare system at the moment. So I just want to answer that. And I don't know if you, Jenna and Tina, if you've encountered that from other folks that you've sort of helped and managed.
Yeah, so thanks, Sharon. So I'll just go back and just add one other point, and then I'll try and answer that question. So no matter which province you're in, and we apologize because by no means are Tina and I experts in all of the provincial plans, although your local respiratory therapist will be able to help, which is part of what we're trying to get across. So each provincial plan, the very first thing you can do to make access to many of your treatments, including antifibrotic treatment, is just make sure you have your provincial, here in BC, it's our pharmacare program. So just that program that helps to cover costs of medication in the province you live. Some people actually have not gone through the processes to make sure that they have that. Once you have that, there's usually a deductible, an amount that you might have to pay, often depending on how much income is coming into the household. So kind of know what that looks like, because no matter which coverage you're getting, there's usually some small portion you might have to pay, whether it's through your provincial program or any third-party insurance program. From there, yes, Sharon alluded to that you often need a respirologist on board. So at the point that you might be needing antifibrotic therapy, and I'll just highlight that those are for the more mild to moderate cases of idiopathic pulmonary fibrosis. Usually the respirologist needs to be the prescriber. So you'll need to have access to a respirologist. And then from there, you often will work with patient assistance programs. So these programs are programs with in relation to the drug companies, but they work with the physicians, they work with respiratory therapists or other healthcare professionals, helping you to get essentially the paperwork done. So trying to figure out whether you qualify, how much this will cost for you, whether this is a treatment option that is accessible to you as part of your own plan. In BC, don't quote me on this, but I can send my email to you and get you the most correct answer. There is some accessibility to scleroderma patients, but again, it would fall under the same sort of criteria. And then to make it even a little more complicated, once you are receiving these medications and you're on a plan for coverage, to maintain that coverage, there's a whole other slew of criteria. So looking at your breathing tests to see whether you're responding to treatment or not, and going from there. So again, another opportunity to work with your patient assistant programs, your physicians, perhaps your local respiratory therapist within the respirology clinic, most likely, to help sort all of this out for you. It's complicated.
Thanks.
Thanks so much, Sharon. Thanks for that question.
Yeah. Back to home oxygen. Yes. So with home oxygen, just also be aware that there are different types of home oxygen people can qualify for. So you might qualify for home oxygen all the time, or maybe just with walking around, or maybe just for exercise. And some people would qualify for it just with sleep. So whichever type you're started with, things can change. So it's important to know that you're getting the right amount and right devices for your oxygen needs. So if things are changing, you do need to reach out to the respiratory therapist, or at least the oxygen provider company, and let them know that things have changed. And then there will be some more paperwork and testing to make sure that you're, maybe escalated to getting the extra oxygen or for more periods of time during the day. And so our key message with the home oxygen is know that the RT can help you get the funding for it, get you qualified for it, and come to your home to help you pick which equipment and set you up with the equipment. I highly suggest keeping the contact information really handy on your fridge, so that if things do change or if you have any equipment problems, you can easily find them.
All right, so continuing on Jim's journey here. Jim has been managing his PF, and all of a sudden he finds himself with an acute worsening of his pulmonary fibrosis. So he's feeling more symptomatic, perhaps more short of breath, perhaps there's more cough. And so there are many names for this. You might hear it being called a worsening, you might hear it called a flare-up, an exacerbation, or a lung attack. And of course, it all depends on the type of pulmonary fibrosis you have as well, whether you may be a little more susceptible to this or not. But like I mentioned, in Jim's case, he's noticed more shortness of breath that's persisted. And he noticed he was more short of breath at rest, which was unusual for him. Normally, he was feeling a little more short of breath on exertion. So he's noticed that change from his baseline. Okay. He noticed he didn't have as much exercise tolerance. He couldn't walk as much as he usually could. So also another sign of change. So when you're trying to see whether this is a flare-up or not, one thing that can be helpful is really having a good understanding of sort of what feels normal in terms of symptoms for you. So for example, can I walk a block and that's and have a certain level of shortness of breath. And now if I notice a change from that can help guide you further as to what your next steps are. So as you can imagine, pulmonary fibrosis worsenings can be really difficult to tease out. And you might be questioning yourself, what's going on? Is this my pulmonary fibrosis getting worse? And for us as healthcare professionals, we're also trying to tease out, is there another medical condition that's happening in your lungs on top of your pulmonary fibrosis? So is there something treatable here that we can treat and get you feeling a little bit better? So you can imagine teasing that out can be really difficult, but we do have some tips for you. Some of the causes, some medical conditions that are common that may be might end up being superimposed on top of your pulmonary fibrosis might be things like pneumonia or heart failure or fluid in the lungs. So the key message for you, don't let these symptoms persist. So once you notice that change, the key is to really take action early. So talk to your doctor or respirologist about an action plan. And an action plan is often a written, individualized plan that kind of walks you through what your next steps are should you start to have persistent symptoms. And the idea is to kind of get that done when things are stable and feeling good, so that you have it in place before worsening happens. Certain pulmonary fibrosis action plans will have you do a bit of a self-assessment. So it might be written out, or you might have had the discussion with your physicians to take certain treatments at home, like an antibiotic if you have signs of infection. So fever, producing mucus, or changes in mucus color, like a darker yellow or green. Whereas other pulmonary fibrosis action plans may actually require you to seek urgent assessment by going to the emergency room. And again, some of that depends on the type of pulmonary fibrosis you have, your health history, and also a little bit about the resources and access that you have in your community. So the key message, respiratory therapists together with your physicians can really help to develop a personalized written respiratory action plan. A respiratory therapist can practice with you on how to use this action plan before worsening occurs, so that you feel really comfortable to know what to do should you notice changes in your breathing symptoms.
All right. Well, Jim continues on his journey, and unfortunately, he does have a worsening of symptoms. And so he ends up calling an ambulance and going to emergency. And so when he gets to emergency, he will be assessed by a respiratory therapist. And so some of the things that the respiratory therapist will do may do a breathing test. So this will be we'll call bedside spirometry. And it's similar to what we would do in a pulmonary function testing, but not as thorough. And so Jim will be breathing through a machine, and that helps us establish a baseline for the admission. And we can check that later in his stay to see if any therapies that we're giving him are working. And we can also compare that to any previous lung testing that he's had done. So we could diagnose or find a worsening. They may take a blood sample, and that would usually be from the wrist, which is blood that comes straight from the lungs. And that will help us tell us about Jim's oxygen levels and his carbon dioxide levels. And it'll help us to guide treatment decisions. The other thing I might do is take a sputum sample. So we'll get him to cough up any sputum into a container, and we'll send that down to the lab for analysis. And it can tell us if he's growing a pneumonia. And if he is growing a pneumonia, then we can culture that to see which antibiotics are going to work best on that. And so key message with going into emergency is similar to what Jenna was talking about with this action plan. If you have this action plan written out, keep it handy and take it with you to emergency, because emergency physicians, pulmonary fibrosis is not their specialty, and they don't know you as well as you know you. So if you are able to explain to them what you feel is normal to you, those symptoms are, and then explain what's different and why you're in emergency that day, that will really help them guide treatment. And if you do have a care plan written up by another physician with, there might be some medication suggestions in there, that would also really help them. And so I think the important thing here is to speak up, speak out, and ask questions. It's good if family comes with you as well. They might be in a better frame of mind to sort of keep track of what's going on and to advocate for you. You and your family are your best advocates.
Thanks, Tina. And so one thing I'll just add here is sometimes we hear from patients about feeling hesitant about going into emergency, and for completely understandable reasons. But one thing that I'll just highlight, especially for idiopathic pulmonary fibrosis patients, often if you have a worsening, part of your action plan is to go to emergency. Often you need to have something called a high resolution CT scan done to kind of see and compare to your previous CT scans. And so that can really help to guide your treatment for this worsening. So again, just another, just as advocating again for you to really talk to your physicians about a written action plan and really be clear on what the next steps are.
All right, so Jim ends up staying in the hospital due to his worsening. And so there are a couple of places that people stay when they're in the hospital. Most people are in the areas that we call the wards. And so each floor or each part of the floor of a hospital may have a different specialty. And in those areas, there's a lot that we can do for people. So one thing might be giving higher levels of oxygen. So we can provide oxygen at home, but it won't be as much as we can give in the hospital. So in the hospital, they have piped in oxygen and we can give quite a bit. So that might be something that would help Jim get over an exacerbation or a flare-up. IV medication, especially anti-inflammatories or antibiotics, if there's a pneumonia brewing. IV antibiotics will work faster than pills. So if it's an acute exacerbation, that Jim might have to stay in the hospital to get the IV antibiotics over the course of a week or so. A lung transplant workup. So one option that we've mentioned for treatment could be lung transplant. And so in order to qualify for that, and we'll get into this again shortly, but there's a lot of medical tests that need to happen. And so those things can happen in the wards. They can do all those tests there. And medication for shortness of breath. So this sort of gets into advanced care planning a little bit. And so knowing that this is a progressive disease, doing everything we can might not actually make sense, knowing that we can't fix it. So there is medication for shortness of breath that can help along with oxygen or instead of oxygen. And so that Jim would feel a lot more comfortable at that point. One place that might be an option is going to the intensive care unit. And it won't be an option for everybody. The intensive care unit can do a lot of advanced things, but some of those things, like every medical treatment, usually has some type of side effects or consequences. And so somebody does need to have a condition that is resolvable when they go to the intensive care unit. So usually the body still needs to heal itself if it's something that's resolvable, but we can support people through that. And so one thing we might need to do is place Jim on a ventilator. That can be through a breathing tube, or it can be through a mask. So temporarily put him on a ventilator. Another thing that's very new technology that's I've seen happen, I work at Vancouver General Hospital and we do it there, is called ECMO. And it stands for extracorporeal membrane oxygenation. And this is like a lung bypass machine where they take blood out and they can put oxygen in the blood, take carbon dioxide out of the blood, and then put the blood back in the body. So as you can imagine, that's very invasive and it's a high risk procedure. But they can do it safely. And for some people who have already qualified for a lung transplant, who have already gone through the workup and approval process, we can support people with ECMO short term while they wait for a lung transplant. This isn't something that would be available at most hospitals. There's only one place in BC, and there certainly wouldn't be multiple places in every province. So it could be an option. It's newer technology, but it is nice when it works. When somebody's in an intensive care unit, it's good to know that family will be making decisions, all the medical decisions for the patient. So it's really important that Jim has discussions with his family about advanced care planning and about his care plan, his goals and his values before a crisis occurs. And so in an intensive care unit, usually the patient is sedated and they're going through such a traumatic experience that we don't deem them able to manage their own care. And so that's why the care planning goes to the family, and the physicians will be having discussions with the family about options and choices to be made. So it's really important, if you have pulmonary fibrosis, to talk to your family and let them know what's important to you. You don't have to know a lot about all of the medical interventions, and respiratory therapists, physicians, general practitioners can help guide you through some of those decisions. But the most important thing is to just tell your family what's important to you. And so writing down this advanced care plan is really important, and do it early. We know it's not a comfortable topic for most people to bring up, but it's important not to wait for the right moment, because a crisis could occur before that right moment occurs. It's good if it's written down. That helps family follow your guidance and your wishes in tough times. And it also is very reassuring for family to know that they're making decisions that you're okay with. And it really makes it a lot easier for them. So do initiate these discussions and approach your caregivers as well if you have any questions. Each province will have resources on how to do advanced care planning there and what the documentation is. Yeah, so look for those online and ask your healthcare practitioners, and they can totally walk you through it. All right, lung transplant. So we're going to touch on lung transplant a little bit here. If you're looking for something more in depth about lung transplant, CPFF does have some talks on their YouTube site, so go and check that out. But we will touch on it a little bit. So lung transplant is not something that's an option for everybody. So it's kind of a very specific population where you're sick enough that you need new lungs, but healthy enough that you can go through the transplant process. It's a very tasking procedure to go through, the actual procedure, as well as the recovery. And so not everybody can tolerate that. And there's also social and physical requirements involved. Again, those will be provincial, but they're very, very similar province to province. So socially, some of the requirements are having social support. If you do get new lungs, you need to have very regular testing. You need to be very close to a major center that can do a lung transplant for months after the transplant and leading up to it as well, to be available to go in and get the new lungs. And so somebody, usually a family member, will need to be driving you to these appointments and supporting you during that time. So either you're going to need a team of people, or you're going to need one person or two people that aren't working that can do this for you. So the social requirement is very real, and it's something that will be really looked into and talked about with you by the transplant team before you would be on the list. And physical requirements as well. There's a whole bunch of testing and stuff that's required. Emotional toll. So being on a transplant list itself can be a bit of an emotional roller coaster. I was speaking with a lung transplant patient who shared his story with me, and he, he qualified, he wanted the lungs, he was on the list, he was waiting. They give you like a pager, and so they have to stay in close proximity to the hospital in case they get the call. And so he got the call, and he was super happy, and him and his wife, and they called all their family and friends and told them, like, he's getting his lungs, and they prepared, they got their bags that were packed, and they went to the hospital, stayed in the hospital, had lines put in and stuff. And then for whatever reason, the lungs were not able, like they couldn't take the lungs to transplant. And so it was very disappointing and crushing, and sort of went back home and had to call all the family again and let them know that no, he's not going to get his lungs right now. And so they went through that 3 times. This big up and down, like, yeah, tell everybody. Oh, and then you have to go tell everybody no. So they did that 3 times, stayed on the list, still had the pager, and got the 4th call. And they decided they didn't want to go through that again. So they didn't call anybody. They just went to the hospital and he got his lungs. And so by the time they were calling everybody, they're like, he already got them. He already got them. So it is quite an emotional roller coaster. The other sort of odd thing to I don't know, come to terms with is, you're hoping to get these new lungs, but knowing that somebody has to die in order for you to get the lungs. So there's no living donors with lung transplants like there are with being a kidney donor. So somebody does need to die, and they would have died anyways, but it's still just something that, I don't know, it's funny. It takes a bit of time to deal with that. And then the other situation to think about is afterwards. So you go from being a pulmonary fibrosis patient, learning about the disease management, how to live with that, learning all about it, to now being a lung transplant patient. And that in itself is like managing a disease process as well. There's a lot of learning, there's a lot of management. Lungs are, they take a bit of effort to live with new lungs in your body. It's not like you just get them and walk away. So there are a lot of advantages, sure, if it goes very smoothly, but also there's a lot of onus on the recipient to live with the lungs, medication-wise, health-wise, and follow-up-wise. So it is a big journey. It's something to take seriously, and it's not one person's decision. A family does need to be involved.
Thanks, Tina. So for Jim, he does decide to do a lung transplant. And so again, the way that process would start would be a referral to a lung transplant program. In Canada, we've got 4 programs: Vancouver, Edmonton, Toronto, and Montreal. Like Tina alluded to, it involves a lot of tests and a lot of assessments with a multidisciplinary team with the transplant program. So we just wanted to highlight to you that respiratory therapists are often part of these teams, whether it's with a lung transplant program or other programs. So again, another opportunity to seek one out to help guide your care. And should you go through the lung transplant process, respiratory therapists will be there to support your breathing, whether it's pre-operatively, so prior to getting your lungs, whether it's managing your care on the wards or your oxygen needs, post or even in community if you're at home, and post-operatively, so after you get your lungs, managing you with your recovery in the ICU with breathing tubes or perhaps a breathing machine, your oxygen needs, and then as you transition to home or wherever you're staying near these lung transplant centers. And everyone who receives new lungs will have to do pulmonary rehab again, because now you're in the situation where you have these new lungs, but you still have your same body, and perhaps that body got deconditioned. So weaker, just living with fibrotic lungs. So often you'll have to do 8 weeks of rehab again as a post-lung transplant recipient. And the other thing, of course, that makes the body weaker after getting new lungs is some people will have quite a long hospital stay and the medications that you're on as well. So no matter which trajectory you might take living with pulmonary fibrosis, at some point, you will have to come face to face with death and dying. And we are human after all. We do know that this is an inevitability. We do know that pulmonary fibrosis is a progressive lung disease. And so like Tina was alluding to earlier, it's really important to talk to your friends and your family, those who you are close to, about what your wishes are. And it can be hard to do that. Like Tina was alluding to, it's hard to know what your scenario is going to be or what medical intervention you might want. And I don't think you need to know exactly all of those things. But often what can guide planning is just knowing you, and knowing you in terms of things you value, things you believe, and really having those written down. And so I know as part of Hope Breathes Here campaign, there have been talks on advanced care planning. So definitely go back and look at those talks if you've missed it. Each province usually has resources. So here in BC, we have something called My Voice through the Ministry of Health. It's a booklet that you can download, and you could just go through each of the pages, and it provides space for you to actually write down what your beliefs, values are, interventions you might want or not want. And also, just as we head into end of life care decisions, having a sense of what that looks like for you, because everyone will be really different. So for Jim, he does end up at some point with looking at death and dying, and just knowing that respiratory therapists can help to support your breath to the end. So talking to your doctors and other healthcare professionals about the palliative care approach, and kind of knowing what palliative means, because palliative doesn't necessarily mean that you're dying tomorrow. Palliative is a very holistic, supportive care approach. You can seek medical intervention, even being under this umbrella of palliative care. So palliative care is really meant to support you. And we hear from pulmonary fibrosis patients, as well as other chronic lung disease patients, that a big fear is this idea of, of choking or just not being able to have breath. And just know that that is not what end stage pulmonary fibrosis needs to look like for you. It can be comfortable, especially as long as you have those conversations and you think about things you might want or not want. As we alluded to in another slide, medication, including opioids, can be used, as well as other supportive maneuvers to help with your breath. One kind of key thing to think about is that supplemental oxygen doesn't always need to be there at end stage lung disease. So don't be alarmed if those conversations come up, or if that's the case. Depending on where you are in your disease process. The other thing to kind of think about in Canada is we do have medical assistance in dying, and that may be part of your plan, and maybe something that you're thinking of. So again, another avenue to get informed and to get the information that you need, and to have these discussions with your loved ones.
All right. So to wrap it up, RTs are superheroes with invisibility cloaks. A lot of people have never heard of a respiratory therapist, but people who need us certainly know that we're there, helping to improve your quality of life. Seek us out. Look for us in the community. Look for us in the hospitals. Use us as a resource, and ask us your questions. Use us for support. And let us help with early diagnosis. Let us help with the management. Let us help you reduce flare-ups. We're there to support you. We're caregivers in the hospital, in the community, and we're through right until the end of life care. Thank you.
Thank you, Jenna and Tina. This has been an absolutely wonderful presentation. I think our audience have learned a lot about the valuable resources that a respiratory therapist can be in their journey with pulmonary fibrosis. So thank you very much. I want to let our audience know that they can put their questions in the Q&A box, and I'd be happy to read them. But in the meantime, I have a couple of questions that were sent to me in advance. Jenna and Tina, someone wanted to know, when they're being informed that they need oxygen, quite often patients are just given a list of oxygen providers. Are they all equal? How does one go about choosing one? You know, is there a method?
That's a good question. And the answer is it depends what province you're living in. So each province has a different health authority qualification. So like Alberta has Alberta Aids for Independent Living, Saskatchewan's got SAIL, Quebec has a national program. So it would depend. In BC, which is what we're used to, we do have one main provider. And so usually people don't need to, shop around. That's just the company they get, depending on whether they were, a war veteran or not. We have like two different streams. If somebody's choosing to use home oxygen that's not paid for by our province, they can get it independently if they choose to pay for it themselves or if they have extended coverage. Prescription is still needed. So you still need to be assessed and have the prescription written to access medical oxygen. So that would be the first step. And then depending on, might depend on where you live, and it might depend on which devices would be right for you. So I'm not sure, it would depend on your area, which companies would carry certain devices. So for instance, like in a hospital, we have like these tanks, but a tank might only last a couple of hours. So when you're at home, you wouldn't be having tanks of gas. They can do liquid tanks, and you can have a big mother tank at home that you fill from. Concentrators are a lot more popular now. So there are big concentrators that you would run a nasal cannula from. And most companies would sell very similar products there. Usually they're not buying the equipment. Usually it's you have coverage and the equipment is provided. So I would say reach out to the providers. Start by reaching out to your provincial resource and ask them if they just deal with certain companies based on where you live, because there might be just a restriction in place already. If you're shopping around for yourself and you are not getting coverage and you're decided you wanted to pay for it, then I would call them around, talk to if you have a respiratory therapist, talk to them, or any healthcare practitioner to get more information on what devices are out there. And then you can ask the companies some more specific questions about what devices they have. Some are fancy and they're smaller and they're portable, but they can't put out a lot of oxygen. So if you have high needs, there might be some restrictions for you there. I would say location and how your funding works would be the biggest factors.
Okay, thank you. And someone also wanted to know, these oxygen providers, for those people who are coming to your home to assess your needs, are they also respiratory therapists?
In BC, they are. I'm not sure about everywhere. So it won't be the respiratory therapist that comes weekly or monthly necessarily to bring equipment, but it would be the respiratory therapist that would go and set you up and determine which equipment is right for you. Yeah. And they would repeat the assessments periodically.
Okay. And how many times a year would you say that you should have them check out to make sure that your oxygen level is fine? Because one patient had said they thought they were fine. It wasn't until they were checked that they were actually informed that they need a higher flow, because they just thought it was just them, right? Because they were kind of tired, they're kind of, low energy. They thought it might have been a disease, but when they got rechecked and at the higher oxygen level, they actually were able to resume some of their activities.
Yeah, that's a really good question. There are ways you can check your own oxygen as well. And I find that a lot of people who have chronic lung disease will check their own oxygen levels at home. There's a certain amount of training that goes along with it though. So if you are getting one of those devices, it's called oximeter, a stat probe. Yeah, so you can buy them. I would speak with your healthcare practitioner though and get them to explain how to use it properly, what to look for, and when to check it. So If you're getting a medical device, please talk to your RT or physician or a nurse about how to use it properly. But if your disease process changes, then you should be going and speaking with your healthcare provider and to find out what's going on. Is it a worsening? And does more oxygen help, or a change in medication help? Jenna, did you?
Yeah, so the other thing that I'll add is I know COVID has changed a lot of things for us. You know, normally if you're going to see your physicians in person, absolutely, you would have gotten some pulse oximetry done to check oxygen. And you could be seeing your physicians every 3 months, every 6 months. Living with a chronic lung condition like PF, at least yearly, you should have some sort of check-in. So that's changed. And so perhaps, like Tina alluded to, checking in yourself might be an option. The check-in from your home oxygen provider, ask them. So when they come in and they set you up and they do the assessment, you know, when am I seeing you again? You know, how often do I need to check in? At the very least, you should always have their contact phone number and know perhaps who the respiratory therapist is or whoever's doing the assessment, you know, what their name is and how to get in touch with them within that oxygen provider company. Because then if you're questioning or you feel like you're due for an assessment, you at least have a way to reach out to somebody. And each company themselves probably has criteria on how often you'll get an assessment, as well as your provincial oxygen company. So the home oxygen company per province will have criteria.
Okay, thank you. Another question that had come in earlier was asking how can you keep fit while you're at home? Because with COVID and everything, a lot of the rehab centers have shut down. It's very hard to go out and access gyms, and people are concerned about catching COVID. So how can one maintain their good health and exercising at home, given that you really can't go out to these places because you don't know what you're exposing yourself to?
Absolutely. That's the $1 million question. And I think that's how Tina and I ended up founding Poplar Pulmonary Wellness, because we just heard this from patients over and over again. So there's lots of different avenues. I'll lay out some of it. So for example, I know Canadian Pulmonary Fibrosis Foundation has some YouTube videos on their website. You can reach out to your lung association, your provincial lung association. But I think if you're looking for that specialized or personalized bit of exercise, especially if you're starting out, you might want to look at us at info@poplarpulmonary.com, because that is one of our goals. There have also been some other online programs like IPF and me. So again, seek out your local respiratory therapist, ask them, seek out your provincial lung association, ask them. CPFF has a lot of great resources. If you're a self-starter, if you've had some sort of exercise in your life before, there are some YouTube videos that might support you. If you're looking for something personalized, this is all new to you, seek us out at Poplar Pulmonary. Anything else, Tina?
Yeah, I think that's the main thing. I mean, you've identified a weakness in the system, and we agree that it is a need, and we're trying to meet it. Yep.
And very simply, if you're able to get out and walk, if you can, that's probably, because even with an exercise program, we're looking at two things. We're looking at strengthening and your cardio, your walking. Walking is just going to help you condition your body to be able to do your activities of daily living. So all the things you normally do, cook, clean, get dressed. So very simply, if you can get out and walk in a safe way in your community, that would be number one.
Great, thank you. One last question from me that I received earlier. Someone wanted to know, are you able to help patients who are still wishing to travel and they're traveling with oxygen? Can you expand on how an RT could help someone that wants to travel, how to figure out how to get oxygen delivered to where they want to go, how to get it on an airplane? Go on.
Yeah, it's a complicated situation, but the first thing you need to do is contact the airline that your ticket is with. So each airline has their own restrictions. Some may allow you to carry your own pressurized oxygen onto the airplane, and others will provide it themselves. So you need to know how much oxygen your prescription is for and which airline. So reach out to the airline for the flight. And then you'll have to ask them specific questions depending on the equipment that you have. So can I carry things that are empty that need filling up when I get there? Can I carry a concentrator? That might be okay. Maybe you could pack it in your luggage. So talk to the airline. And then when you get there, that's a complicated question. I don't have a lot to say. I believe you would have to be responsible for the funding of that on your own. Do you know, Jenna?
Yeah, so I'll just add into what Tina was saying. So there is specific paperwork as well for the airline. So again, you can look that up on the airline itself. If you do have a respiratory therapist who you're able to access, they may be able to do that for you as well. And sometimes it needs a medical sign off. So your family doctor or your lung doctor. Work with your oxygen provider. So some of these oxygen providers do have provide oxygen in other countries. I mean, I think the most common one might just be within North America. So see whether you can work with your own oxygen provider to access oxygen where you're going. But again, depending on your device, you might be able to use your same device like a concentrator. But there will be some of you who may need to access or fill up oxygen when you get to where you need to be. So I think the long and short of it is planning. So do it early. And a little bit is going to be, of course, if you already have oxygen, knowing what your levels are when you're in flight, knowing your equipment you're going to use, getting that equipment approved by both the airline, which will involve paperwork and a medical sign off. And then once you get to your destination, are you using the same equipment, or do you need to work with your home oxygen provider to coordinate equipment once you get there?
Okay. Yeah, and most of them will rent equipment. So maybe a short-term rental would be something worth asking about too.
All right. Well, thank you, Jenna and Tina. I don't see any more questions in the Q&A. Thank you so much for this wonderful session. I know our audience have learned a lot, and we appreciate having RTs in our journey with pulmonary fibrosis. So thank you both.
Thank you very much. Thanks for the opportunity.
Yeah, thanks for having us. Thank you so much.
Okay. Goodbye, everyone.